Nitya, while analyzing your social media platform, I was so impressed because you came to Australia alone. You studied Bachelor in Nursing, university fee, living expenses on your own, and now you are a registered nurse and Australian citizen. I'm so proud of your journey. It's
Thank
really
you so
inspiring.
much. See, I've done all the hard work and I'm in a place I am right now. And I'm hearing your show, sharing my journey with everyone. That really feels amazing. Thank you for having me on your show.
I was so excited to invite you for NEXWEB podcast because I came to Australia with my husband and it was really difficult being a migrant. And you were alone and you were studying Bachelor in Nursing and it has a high fee, like it's very expensive and you did it alone, other field.
Well, this is very strange and different because I wanted to be a doctor, but then at the same time, I didn't want it to stay home. I don't know, because I felt like coming out of the country would be a bit of freedom from everything. You don't have to hear anything from your parents. You can be on your own and all those things. So I did try for overseas as well, but for some reason I just didn't want to just go to Chitwan and study. So that's why I was thinking to go US. For some reason, I feel like what is meant to be will find your way kind of thing. So for some reason, I couldn't apply US. I don't know what happened. I can't remember. But then I ended up applying Australia. And so when deciding Australia, what do you want to do kind of thing. So I was like, medicine in Australia is impossible for me. I didn't want to do anything else. So what is the closest thing closer to being a doctor? So I was like, probably nurse. And then with nursing, there was like so much of opportunity in Australia. We already knew when I was back home as well. So it was like in terms of money, in terms of PR, in terms of settlement and everything. I know the process was hard, but I think all these reasons together made me choose nursing.
What challenges did you face during your studies and after becoming a registered nurse? I think that there are
So
lots
many.
and
There's
lots of
so
challenges.
many. I think too, when studying, the most common one would be obviously being away from your parents. Like at first place, I wanted to be away from everyone, have my own peace and everything. But when you're here, like financial, social, economical, and all those family, emotional supports and everything. Those were the most challenging. But I think with the rest of the thing, you could cope. But I think mental stress and also financial stress was a lot challenging. And as you know, with nursing, you have to do like 800 hours of unpaid work just to get your degree done. And then at the same time, you have to pay those expensive fees to get that. You have to work, and at the same time assignments, placement, financial stress. You have to eat, you have to manage your social life, your family and everything. It was very challenging overall in terms of getting that degree. After that degree, obviously it's not easy still. So obviously I was an immigrant, I wasn't raised here, born here or whatever. So my English was not that great when I started. And then understanding medical terms, because I work straight in hospital. So getting to know a lot of things you don't know. You don't have the confidence in communicating with people. Like I would be scared to talk to the doctor, pharmacist, whoever comes around. Like I was so scared. And if I couldn't pronounce anything, I would be scared to talk about it to anyone else. But because I would think on back of my head, like, oh, what if they think that I don't know things and stuff like that. So even until now, there are so many things that I can't do because I studied in Sydney. I don't know if you know, but I studied in Sydney and I started working in Melbourne as a first job. So it was very tricky because like the way I studied in Sydney was different to the way they work in Melbourne. So it was very challenging. But now I feel like I've adjusted it to the environment. I've done a lot of work within myself and I feel like I'm overcoming it. It's just the one thing that you don't have to let your fear win. If your fear wins over your confidence, then you are just way behind. But I didn't let my fear win over me. So I just let my confidence be on top of that. So I'm in a place I am now.
Nitya, before becoming a registered nurse, to pay your university fee to become a registered nurse, I think you have done lots and lots of jobs. Can you explain some sort
Yes,
of
of
jobs
course
you
I
did?
can. So when I came into Australia, my first job, which was not a good experience, but I think that shaped me to a person I am now. I did work in one of the Nepalese restaurants. I was not treated well there, so I couldn't stay longer and I was paid very, very, very less. But at the end of the day, I wanted some money. When I left Nepal, what I thought on my head was like, this was the end of asking money from parents. I'm going to do everything by myself. That was the mindset on my head. So I was ready to do anything and everything. I was a spoiled child. I was very spoiled child, but I was like, on my head, I am not asking any money from my parents. So the first job was in a Nepalese restaurant. That didn't go well. I did work for 2 or 3 days, I think, and that was it. And then after that, I started working in Hungry Jack's. So I worked in Hungry Jack's Parramatta. I worked for a bit. And then after that experience, I started working in Macca's because I knew a bit and then I knew how to talk to people. I knew how to take orders and stuff like that. I started feeling a little bit confident. And then I started working in Macca's and I did a bit of cleaning job. I did house cleaning. I used to go to people's house and clean their house. I did bar cleaning and everything. But you know what? In few years, when I got into second year of nursing, my life changed drastically because of I'm a second year undergraduate nursing student. I could get a job as an AIN. So that's how my life changed from working 5 jobs. Used to get up at 4 a.m. in the morning, finish my shift at 12, come back home, sleep for a couple of hours because I wouldn't drive. I had to take train and that would take forever. So I would get like 4 or 5 hours of sleep and run on that for every day, 7 days a week. When I look back at my tax return and stuff, when I look at the money that I made when I was student, I would feel like, oh my God, this girl did a lot.
One point triggered me, Nitya, while you were speaking, because we both have migrated from Nepal, and I have also worked in Nepalese restaurant. And I just want to say from this podcast to all the Nepalese owner, because we belong to the same community. Even I work there, and I didn't feel belonging. Like we have the same community, we eat the same food, we speak the same language, and even the customers are of our own culture. But I didn't belonging. I was also struggling because I had a baby and I could not go far at the time. And it was a COVID period. And I was offered a job in a Nepalese restaurant. And I was so happy because it was just 2 minutes walking distance from my place. And the way they were treating me was literally triggering. Still, I'm so much triggered by the work I did and the words they used me and the money they gave me. So it's really triggered me while you were speaking about the Nepalese restaurant. And I sincerely want to request from this podcast that all the Nepalese owner please behave properly to their staff because they are the asset. Because no Australians, no Indians, any country people want to work for you. Only the Nepalese people can work for you because they know the language, they know the taste of food, they know the culture. And if you treat them properly, it will be really beneficial for them too. I'm so triggered because you
I
told the
think
word
I think
Nepalese
from what
restaurant,
I can see, social media is just like a surface. You don't know the depth. But from what I can see, a lot of people, a lot of restaurants now are treating people well. Well, I don't know how they feel about it, but that time it was really, really, really bad. Well, I know that restaurant doesn't exist anymore because when I started feeling a little bit better, I went in to see if the restaurant still exists, but it wasn't there. So things might have changed for them.
You migrated from Nepal in Australia and now you are an Australian citizen. What sort of differences have you personally feel being a migrant and now being an Australian citizen in
Yeah,
terms of
in
facility
terms
and
of
many more?
feelings, yes, I feel proud about what I've done. It's not about proud being Australian or whatever, because I feel like I'm in a country. Obviously, I would need opportunity to grow myself, to do everything I want to, because I've considered this as a second home. Yes, my first home is Nepal for sure, but this is my second home where I live. I've done everything and everything. So that's why taking a citizenship was a bit tricky anyway. In terms of facilities, when you're migrants, obviously the fees, you can't invest on anything. You can, but the interest rate is very high. I've done my postgrad as well after I got my permanent residency, which was for free. Imagine paying 28,000 a year to finish your nursing degree and then you studying for free. So for me, in terms of changes, I would say investment, buying a property, getting a loan from the bank, like getting cars and stuff, like any sort of assets you want to add up, the loan is easier and the interest rate will be okay for domestic people. Whereas for international people, I think the loan process itself is very high as well. Second thing was a lot better in terms of study because I could study for free. Even though I want to do a big degree, I can do it on HEX. I know it is interested at the same time, but that and also you don't have to stress about visa because a visa process itself is very stressful because you have to pay a lot of money, you have to wait, and then on that side, you have to keep on moving on with your life as well. So I feel like that kind of thing was changed when I got my permanent residency or citizenship. And also the security, I can get my parents to come in and stay here now. I feel like well settled. But when I'm on visa, I used to feel like, oh, I have to go work, I have to study this and that. Like in terms of a lot of things that had made me easier. And also on top of it, I like to travel the world. So with my passport, I'll be able to travel the world without being able to stress about visa and stuff. So a lot of things have changed in terms of that.
As a registered nurse in one of the reputed public hospital of Australia, are you personally satisfied with the period, facility, as well as the healthcare system of
In
Australia?
that,
What's your
I
view?
would say registered nurses are not paid the work they do. Recently, okay, let me announce it from this podcast. I have started a role as clinical nurse specialist within 2 years. So I've recently started this role. It's been 2 weeks. The pay is quite good in that sense, but as a base of registered nurse base pay, it's not that great. But the thing is, with afternoon shift, night shift, weekends, public holidays and stuff, it comes out to be good, but still not enough for saving a life, I would say. Facilities and stuff, yes, there is a lot of facilities. I didn't know that until a few months ago. One of my colleagues got pregnant, and I heard that a lot of private organizations don't pay maternity leave. So, in terms of that, if you work in a public sector for 1 year, you get maternity leave, you get your annual leave, sick leave, and also if you work weekends and stuff, they were giving us additional leaves to take on top of it. So I kind of feel like in facilities and stuff, it's good in terms of career growth. If you study, if you are motivated to your job, not like it's just way of making money and stuff, then you have a lot of growth in nursing. Let's say if I don't like a pay as a bedside nurse, I can always go to a travel nursing because I know travel nursing makes a lot of money. I can go to community nursing. I can go to mental health nursing, pediatric nursing. I feel like once you set up your base as a nurse, once you set up your basic skills, you can go anywhere and make as much money as you want. So, in terms of yes, if I want to stick with bedside nursing, the money is not good. But if I want to shape that as my career opportunity and get all the skill done, know all your communication, know all your nursing skill, then you can go anywhere on the world and sell yourself, sell your degree and make money out of it. So I kind of feel like it has a wide doors open for you. You just have to know what is right for you and go to that door when you feel like when you're ready. It's not like, oh, she said that I can make money out of it and jump into it, but think what is right for you, know all your skills. First, find out what you want to do and then step into that. Trust me, money is there in nursing. You just have to come out of your comfort zone and you have to get all the skill ticked off because it is easy to get job as well as it is easy to get your registration off you as well. And you've worked hard 4 years to get that nursing degree, spend a lot of money. So be careful on what you do, but there is so many opportunities in nursing.
And what about the healthcare system of Australia? And I know you have experienced the healthcare system of Nepal also. Can you compare between these two both
In Nepal,
countries?
I didn't get involved in a lot of healthcare facilities and stuff. Yes, when my mom was sick, I did went in for a couple of times and stuff, but I haven't experienced a lot from what I've heard from nurses who studied nursing over there as well. I heard a lot about it. The system here is quite good in terms of health and stuff, but obviously both have pros and cons. Nepal has some good healthcare practice, whereas here they're good in terms of some others as well. So both countries have based on what their economics is, based on the country, their assets, the finances and everything. I feel like Nepal is a bit no hate, nothing. I don't want to give any negative message from here, but what I'm trying to say is because it's a very small country compared to what Australia is in terms of economy, in terms of politics and everything. We all know what's happening in there as well. So I think health system back home is not as best as it is here. Here it is like you have your patient right as well. You have your family right. You have right to your information. You can say no if you don't feel like, okay, I don't want this treatment. I would rather die. You can say no as well. Obviously, there will be encouragement, but you can say no. Health system in here is so much based on what you want for yourself. Obviously, there will be suggestion because when I get sick, I don't know what's happening with me, but the doctors, nurses, everyone would be involved and tell you that what is good to do. But in saying that it will be your decision, your family decision, if you don't have the capacity to decide for yourself, to make that medical treatment. So I kind of feel like here they involve you, your family, and everyone. And also, like, there's so much support. Like, let's say if someone comes in with a wound, it's not doctors only dealing with it. It's not nurses only. The wound care nurse will come in. Plastics will come in. Like, so there will be a lot of people involved in it. So I feel like treatment in here is involving a lot of people, a lot of multidisciplinary team and everything. So I feel like I don't know how things work back home. I've seen my mom being sick. Very sadly, it's so sad to say out on this social media platform. You know how here, when you're a citizen, when you're a permanent resident, or even when you are waiting for your permanent residency after you get your invitation, you get Medicare. I know Medicare doesn't cover a lot like it used to back in the days, but even if I go to public hospital, all the treatments are free. How good is that? When you're sick, you don't have to worry about not having money because it is covered by government. I know you pay while doing the tax return and stuff, but still, you're getting everything covered when you're sick, and you can worry about the rest of the thing after. When you're sick, you're not taking stress about money. But back home, when my mom was sick, she had to pay everything out of her pocket. How stressful that would be if she had no money then. Luckily, she was well settled and stuff, so it was fine. Now it's a good thing. Like, I don't know, a lot of people don't know about this, but they have insurance now back home, so you don't end up paying a lot. You still pay a little bit, but it's so much better now. I think it is improving slightly. It takes time. Everything is like slow process back home. Probably that's why it's taking a bit of time. But I feel like health system here is good, really good in terms of looking after people and like getting them the help when they need it, rather than worrying about financial stressors. And if you can't work because of your medical illness, there is so many support that you get as a domestic though. Because and even when you're international, they don't throw you out of hospital because they will try to find out the way to get money out of your insurance and stuff. So I kind of feel like financial, medical, they are very considerate and the treatment is good in here. People might have experienced bad because it just sometimes it doesn't work well for everyone. But yeah, I feel like the health system here is way better. But in saying that, Nepal is improving a lot in medical field from what I've experienced from my mom, that instead of getting all the money out by herself now, the insurance covering, and even the doctors are really good now because they are studying out overseas as well. And even I think the study in Nepal is really good for the medical field. So it's improving.
Nitya, before you have mentioned that you found the difference in nursing field in Sydney and Melbourne. Can you explain what sort
Yeah,
of
there was a
little bit
lot,
difference
even
was there?
simple thing as equipment and stuff, because I did hold my placement over there. I did study in there. Whatever practical I did, it was in Sydney. So when I was studying in Sydney, they would not do bloods as a student because here, when you come in, I think it was my fourth or fifth shift. I can't remember, but fourth or fifth shift, they asked me to collect blood from a patient. I'm like, I don't know how to collect bloods, but I am someone who is not scared to ask questions. So I asked someone, hey, can you teach me how to do blood? They did teach me, right? But it was taught once. How would you be able to take bloods out of a patient when you were taught once, when you have to do so many times? And then I think that was a major difference for me. I used to freak out when I see bloods because I was not used to taking bloods. I was not used to that. So I think with time that overcome, but that was one of the major difference that I found. And another thing is like I know a lot of people who are not into nursing would not understand it, but there is something called PIC line, which is connected to your heart. It's like a cannula as well, but when someone is for long term medication and stuff, they do it from the central line, which can stay there for months and months. And in Sydney, to remove that, they used to go to theatre and remove it back in the days. I don't know how it is now, but back in the days, they used to go to theatre and take it out. And when I was here, they were like, oh, can you take the PIC line out? I'm like, PIC line out on the ward? I was so shocked. But in Victoria, yes, they do. So there were like so many. It's just two of them. There were so many differences that I have to overcome when I moved from Sydney to Melbourne to work as a registered nurse.
What suggestion do you want to give to those migrants and newcomers who wants to pursue their career in nursing
Well,
field?
there is a lot. There is a lot. Don't give up. Don't give up. You might see me and think, oh, she is so settled in her life. But trust me, the phase that no one has seen. I have seen it. I've done 4 jobs in a day without any complaint and make more money than what I make now because I was that time obligated to pay my uni fees just in order to finish the degree and be in a place. Days are hard. You don't have your parents next to you. Sometimes you don't have friends around you. Sometimes you don't have money. Sometimes you don't have food to eat. Sometimes you don't understand the assignment. Sometimes I feel like I don't understand English anymore. So, all those things, trust me, take it easy, take a deep breath, and forget about everything. Think on your head, on your imagination. Think of the days that you'll finish everything and you'll be in a place where you want it to be. And imagine that place when you have like nicest job, you have good house, you have a nice car, you have everything you wished for, you have good health and everything. Think about that and work hard now. Trust me, good days are yet to come. I still have bad days. Trust me, everyone has their own struggle going behind the scene, which some people do say it, some people don't. Trust me, it's not the end of the world. Keep working hard on your goals. Good days will definitely come if you work hard.
I have seen some of the people, I don't say some, most of the people, when they come to Australia, especially the Asian community, they choose the different field and at last they end up pushing the career in nursing field, although they don't have interest. Just because of the facility and the pay rate and the shift availability. What solution do you want to give to those people? Should they really study nursing even if they
Well,
don't have no
I would not
interest?
say anything for their personal choice, but if you're not interested, I would say not do it. Because trust me, if you do something wrong, we've seen a lot of news where people are not interested and they just like do random things, and then sometimes they get caught and then like there will be bruises and stuff and everything. I feel like if you're not interested, don't do it because it's the role, the study that you're doing to be a nurse is to look after people, care for them, love them, help them get better. Trust me, the achievement that you feel when they come in sick and go back home better, it doesn't come if you're not interested in it. If you're not interested, don't do it. I know a lot of people get tempted with money, PR, and then flexibility. If I can't do morning shift, I can do night shift and all those kind of things. Yes, I do. I know it is very tempting, but if you're not interested, it's not worth it. If your registration gets taken away, think about how much mental stress it will cause on you. Think about you not interested and your family is being looked after by a nurse who is not interested in nursing at all. She's just there to make money. So I kind of feel like don't do that. But if you say that it will make you interested in future, if something can change, then yes, you can try. By the time you finish nursing, if you feel like you're going to be interested in it, then it will be a different thing. But if you feel like I have no interest in nursing, I'm just doing it for money, then please don't do it. It's someone's family, it's someone's loved ones, you're looking after a sick person. Imagine if you're not interested in it, if you're not passionate about it, it's not going to end good for you and for the people you're looking after as well. So, a big no.
Nitya, where do you see
Oh,
yourself
that
after
is a
5
good
years?
question. I see myself because I did start educating new graduate nurses, student from 6 months. I started nursing. So back in 2021, I started doing that preceptor coach model. That's what it's called in Melbourne. So it's pretty much helping the new graduate nurses and students get their skills ticked off before they work as a registered nurse completely on the floor or else before they go back to uni and graduate. So I've been doing that for a while. So I see myself being an educator of Alfred Hospital, I guess. And I set my goals, like obviously some of them I can say it, some of them I can't say it, but I set my goals of what I want to see myself as, obviously in terms of financial, in terms of career, in terms of family, relationship and everything. I set my goal beforehand and I worked hard for it. In 5 years, I see myself going to getting all the goals ticked off. I work really hard and I will see myself getting everything ticked off. But out of everything, the only thing I would say is I see myself being clinical nurse educator in future and educating people and probably doing
Wow.
more videos to help people out there who is struggling with their mental health during nursing, finding it really difficult. And I've started doing that already. So I see myself doing more of that and also being an educator to a lot of new nurses who will be starting.
And
Oh
what
God,
about
I have
traveling the
got one
world?
holiday booked in June. I will be traveling a lot as well because I do two overseas holiday in a year. I try to do two at least. I do one around August and one around January, but this time I've got a random one booked for June. So I love traveling because I feel like I'm what I am because I've seen a lot of people. Because I went to Fiji in January. It's totally irrelevant of the topic, but I want to say how things change. So I went to Fiji in January, and I didn't see a single person that was unhappy in Fiji. And I was like, how much do you make? How can you be so happy when I complain about everything in life? And then they told me, life is short. I don't know when I sleep if I will get up or not. If I don't get up, I don't want to think myself as a miserable person. I want to die in peace. And that triggered me so much. I feel like, oh, yes, true. Surprisingly, they only get $5 an hour. $5 there is like roughly $3 in here, $3 to $4 in here. So they were so happy. So I feel like traveling the world made me so wiser and think about that perspective. What if I don't wake up tomorrow? I don't want to be harsh to someone else. I don't want them to remember in a way that rude nurse or that rude person. She's so rude. She doesn't have heart in her and all those things. So I feel, yes, I'm going to travel the world and learn from people. That was the best way of learning for me. So yeah, that is, and to be able to afford to travel the world, obviously I need to be a nurse too. Getting satisfaction and peace from my job and traveling the world, that's giving me another piece. So that works well for me.
Nitya, it was great talking with you. Thank you for your time and sharing your nursing journey. It was really
Thank you so much for
inspiring.
having me
Thank you
here.
so
I
much.
feel very happy to be able to share my journey out on your podcast, and people will be able to hear and think about different perspective now. So I'm so glad for having this opportunity, and thank you so much for having on your podcast.